Have you ever wondered what happens if a Saline breast implant experiences a rupture, and how would you even know? It is a common concern for many, and understanding the detection process can bring a lot of peace of mind. Saline implant ruptures are primarily detected through a noticeable change in breast size or shape, often accompanied by a feeling of deflation. This is because saline solution, which is essentially salt water, is safely absorbed by the body if the implant shell breaks. The most immediate and common indicator is a visible reduction in the size of the augmented breast, sometimes occurring rapidly over a day or two, or gradually over several weeks. The core reason for this visible change is the nature of the saline solution itself. Unlike silicone gel, which remains largely contained even if the implant shell is compromised, saline simply dissipates. The body naturally processes and absorbs this sterile salt water without any harm, leading directly to the deflation. The implant shell, typically made of silicone elastomer, then loses its internal pressure and collapses, causing the noticeable alteration in breast contour and volume. If you suspect a rupture, the first step is always to contact your board-certified plastic surgeon. They will conduct a physical examination, observing any asymmetry or changes in breast shape and size. Following this, imaging studies are often utilized to confirm the diagnosis. A mammogram or an ultrasound can effectively visualize the implant and surrounding tissue, helping to identify the presence of a collapsed shell. Magnetic resonance imaging, or MRI, while highly accurate for silicone implants, is generally not needed for saline ruptures due to the clear physical signs and easier detection methods. An interesting aspect of saline ruptures is the phenomenon known as a silent rupture, which is far less common than with silicone implants. While saline ruptures are usually symptomatic and obvious, a small tear might allow for very slow leakage, making the deflation gradual and less immediately apparent. This highlights the importance of regular self-examinations and professional checkups, even if you do not notice a sudden change. Another key detail is that saline implants typically have a valve that can occasionally fail, leading to leakage without a full shell rupture. Understanding how saline implant ruptures are detected empowers you to be an informed participant in your own health care. Recognizing the physical signs and knowing the appropriate diagnostic steps means you can address any potential issues promptly and effectively, ensuring your continued well-being and confidence.